Good afternoon, everyone. Welcome to Scarborough Health Network Centenary Hospital. I'd like to begin with our land acknowledgement. We acknowledge this land, as well as the land of all three Scarborough Health Network hospitals, stand on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, Métis, and Métis people. We pay tribute to the living legacy of all First Peoples of Canada as we strengthen ties with the communities we serve. Today marks the beginning of something incredibly important, not just for our hospital, but for the hundreds of thousands of people who rely on us for emergency care. I'd like to thank the Government of Ontario, Minister Jones, Minister Thanigasalam, Minister Cho, MPP David Smith, the North Pine Foundation, and John and Kathy Phillips in particular, our project partners, and everyone whose vision and support have brought us to this milestone. Scarborough is one of the fastest growing communities in Canada, and nowhere is that more visible than in our emergency departments. At Centenary alone, we've seen emergency visits increase by more than 30% over the past 4 years. This year, we're on track to care for nearly 92,000 patients, with demand continuing to grow by roughly 7% per year. Most organizations would expect that kind of growth to come with longer waits and greater pressure. Our teams have proven something different. Despite caring for more patients than ever before, admitted patients are moving through our emergency department more than 6 hours faster than they did 4 years ago. Patients who don't require admission are completing their visits more than an hour faster, and fewer patients are leaving before they're seen. That doesn't happen because of a building. It happens because of extraordinary people. To our physicians, nurses, allied health professionals, support staff, and volunteers, thank you. Your commitment to innovation and exceptional patient experience and care has made these results possible. Today's announcement allows us to build on that success. Today, we're building the future of emergency care for Scarborough. It is now my distinct honor to welcome Minister Jones to the podium. Thank you.
Well, thank you, David, and good afternoon, everyone. It is indeed great to be back in Scarborough alongside your local MPPs, Raymond Cho, Minister Vijay Thanigasalam, and MPP David Smith. Thank you to the team at Scarborough Health Network Centenary Hospital for hosting us today, and for everything you do to provide exceptional care to patients and their families each and every day. Under the leadership of Premier Ford, our government continues to make historic investments and take decisive action to protect and strengthen healthcare, meet the needs of local communities, and make it faster and easier for people and their families to connect to high-quality care close to home. We continue to build capacity throughout our healthcare system, growing and supporting our world-class healthcare workforce, including adding over 100,000 new nurses and over 20,000 additional doctors since 2018, and investing in the largest medical school education expansion in a generation. Through our $3.4 billion Primary Care Action Plan, we are significantly expanding access to primary care across Ontario. Here in Scarborough, more than 13,000 people were attached to primary care last year alone, including at the Care First Family Health Team, which we had the pleasure of visiting earlier today, and they are doing incredible work. And this year, we are on track to attach more than 38,000 more patients to primary care right here in Scarborough. We are opening 16 new primary care teaching clinics across Ontario, with 2 of those clinics located right here in Scarborough, providing hands-on learning for family medicine residents. This expansion of primary care not only provides patients with the ongoing care they need and deserve, but plays an important role in reducing pressures on hospitals like Scarborough Health Network. And we are well on track to meet our commitment of connecting every Ontarian to primary care by 2029. Since 2018, our government has increased funding for Scarborough Health Network by 50%. We also continue to make key investments to expand and modernize Ontario hospitals and local healthcare facilities. This includes investing over $7.2 million in Scarborough's health network to support critical infrastructure needs at all of your hospitals, a 50% increase over last year's funding. And we invested nearly $15 million and added 27 new hemodialysis stations at Scarborough Health Network, including 21 right here at Centenary Hospital. That we are now fully operationalized and will connect more people to life-sustaining renal care close to home. Last year, I was pleased to visit your general site to open your state-of-the-art North Pine Diagnostic Imaging Department. And today, we are celebrating the start of construction of the new emergency department at Centenary Hospital, supported by our government's investment of more than $82 million, which will mean an expansion of over 36,000 square feet larger than the existing ED, expanding capacity to meet the needs of Scarborough's growing population. This new state-of-the-art ED will reduce wait times and provide Scarborough Health Network with the additional capacity it needs to better care for the more than 200,000 patients it receives every year in the 3 emergency departments. This is part of our government's $64 billion investment in more than 50 major hospital projects across the province, which will deliver approximately 3,000 net new hospital beds on top of the 3,500 we have already added since 2020. Today's milestone will connect more families in Scarborough and across the eastern GTA to the emergency care they need for generations to come. Thank you again to the fantastic team here at Centenary Hospital and all the amazing healthcare workers across Scarborough's health network. You know, it takes team players, it takes clinicians, it takes donors, it takes volunteers, it takes leaders. And that compassionate care that you provide and the tremendous impact that you have on your community is absolutely making a difference. It's now my honor to invite Minister Vijay Thanigasalam to share a few words. Thank you. Stay well.
Good afternoon, everyone. Thank you, Minister Jones, for that incredible announcement and for your leadership. Thank you. I really mean it. Because standing here today, I'm very proud. Today is a milestone for Scarborough because this is long time coming. Standing here today at Centenary, Scarborough Health Network, Centenary Hospital, a true pillar of care for generations of local families when we are witnessing real, tangible actions. Before Premier Ford's government took office, healthcare in Scarborough was completely overlooked. For years, there was zero meaningful investment in health infrastructure in this community in Scarborough. Today, thanks to Premier Ford and Minister Jones, we are rewriting that narrative. Not only we are bringing Scarborough's very first medical school right here to train doctors of tomorrow, but we are also backing it up with more than $82 million investment to expand the Scarborough Centenary Emergency Department. This expanded emergency department will ease overcrowding, support our frontline doctors and nurses, and ensure Scarborough residents get the high-quality care they deserve right in their own neighborhood. From training local physicians to building modern hospital facilities, Premier Ford's government said we would build a stronger healthcare system for Ontario, and today, right here in Scarborough, we are delivering on that promise. But infrastructure is only the half the story. The real heart of Scarborough Health Network is its people. To the exceptional doctors, nurses, allied health professionals, and support staff, thank you. Day in and day out, through incredible pressures, you deliver world-class, compassionate care to this community. You deserve a facility that matches the level of care you provide every single day. And that's what this new Scarborough Centenary Emergency Department will bring. Thank you, and it is my distinguished honor to invite Minister Raymond for his remarks. Thank you.
everyone. It is my honor and pleasure to welcome Deputy Premier, Minister of Health, the Honorable Sylvia Jones, back to Scarborough. Thank you for your continued commitment to our community and for investing in the health and well-being of Scarborough residents. This important investment will strengthen our healthcare system, improve access to care, and help ensure that residents can continue to receive the service they need close to home. Under the leadership of Premier Ford and your steady hand as Minister of Health, the people of Scarborough are grateful for the support and partnership in building healthier, stronger Scarborough. You are always welcome in Scarborough, Minister. Thank you.
Good afternoon. I don't think I needed an introduction. Ladies and gentlemen, it's a great day to be gathered here today for such a historic event at this milestone. I'm very excited to be witnessing this major milestone for the Scarborough Health Network here in my riding of Scarborough Center. Scarborough Center is a big, continually growing community of approximately 125,000 people and a total of 650,000 in Scarborough as a whole. I'm excited to see this great work which will be supporting over 200,000 patients with better emergency care, ease the congestion, improve patient/staff flow, and give them the privacy that they need and deserve, and connect more people. I am pleased to see our government investing a critical infrastructure to support the needs of hospitals. This investment will improve access to timely, high-quality care by connecting more people with family physicians, nurses, practitioners, and other primary care professionals. It will also bring more dialysis services closer to home through new hemodialysis station, thereby improving patient flow and increasing capacity to better serve our growing community. Grateful to the Minister of Health, the Honorable Sylvia Jones. You are amazing. We keep crossing paths for days now because the Minister does not stop. She wants to make certain that all 50 of the development of hospitals in the province, she's keeping a great tab on it. And today, I can say I'm so proud to know that we are going to be building a brand new emergency setting right here in Scarborough to meet the growing demands. Our Premier Doug Ford for making Scarborough a high priority for such a bold initiative. I'd like to thank you, and I'd like to present Dr. Vijay.
Can I have your
Thank
attention,
you.
please? Code blue, emergency department. Code blue, emergency department. Code blue, emergency department.
All right. I know. All right, thank you. As an emergency physician, I've had the privilege of caring for thousands of patients and families at Centenary Hospital. When people come through our doors, they're often experiencing one of the most stressful moments of their lives. They don't think about hospital design or patient flow. They simply want to know they'll receive excellent care from people they can trust. That will always be our guiding mission. But behind that simple expectation is a reality our teams face and live every day. As was highlighted, we're seeing over 30% more visits this year than 5 years ago. And that doesn't just mean busier waiting rooms. It means 30% more patients potentially needing inpatient beds and specialist consultation, clinical decisions that have to be made 30% faster just to maintain the same standard of care and wait time performance, and needing a physical space that can keep pace with the acuity and volume our community relies on us for. Our current footprint was built for a different era of emergency care. This new building isn't just bigger. It's designed around how emergency medicine actually needs to work today. That's why today's groundbreaking is so meaningful. On behalf of our physicians and clinical teams, I want to thank North Pine Foundation, Government of Ontario, and the Ministry of Health for this investment in Scarborough. This is a capital investment in a new emergency department, but it is also a recognition of SHN's unique growth story and the rapidly increasing needs of the community we serve. We are grateful for your partnership in building the health service capacity Scarborough needs and deserves. The new North Pine Emergency Department will be the first purpose-built emergency department in Ontario designed around our accelerated model of care, a made-at-SHN approach to emergency flow and operations. We've piloted this model, elements of this model within our existing space, and even in partial implementation, we've achieved peer and region-leading emergency department performance while overcoming the fastest growth in emergency patients we can measure anywhere in Ontario. It lets us take what we know works and build it into the walls, the workflows, and the way our teams operate from day one. It will allow us to deliver care more efficiently while maintaining the quality and compassion our patients deserve. While today marks the beginning of a new building, what has always made this place special is our people. I'm incredibly proud of the physicians, nurses, allied health professionals, and the support staff. Their dedication has allowed us to care for more patients than ever while continuing to improve how we deliver care in the emergency departments. Every patient who walks through our doors deserves the best care we can provide. Today's groundbreaking is an investment in our patients, our teams, and the future of Scarborough. It will help us ensure that we are ready for everyone who needs us today, tomorrow, and the generations to come. Thank you.
We will now open it up to questions from the media. Media present, please line up behind me at the microphone and state your name and outlet. As a friendly reminder, the format is one question, one follow-up.
Hi, Minister. Jack Howard from the Trillium. Minister, your government asked hospitals to submit 3-year spending plans related to spending cuts. Your government has refused to release these plans, but your office promised that those cuts won't impact patient access to care or services at any hospital. If that's true, why not be transparent and release them?
Because we're in the second year of a 3-year process. So our path to balance, we asked, yes, every single Ontario hospital to submit a plan to see and where they can get to a zero deficit. That work is ongoing. We have active regional tables right now that are working with their peers regionally to make sure that best practices that we see every single day, innovations that happen in hospitals across Ontario, making sure that those innovations can actually be shared and scoped to other hospitals. You know, our government for the last 4 years has increased hospital baseline budgets by on average 4%. And what that means is we are absolutely committed to making sure we continue to provide world-class care in the province of Ontario, but we also want to make sure that the innovations, the creative ideas, whether it's in emergency department redesign, whether it's in rehabilitation, surgical changes, innovations, are being shared across our hospital systems, and that's the work that is ongoing right now. Thank you.
QP held a press conference this morning highlighting that those 4% increases that you mentioned haven't kept up with the needs that hospitals are facing, increasing population, aging population, to the point that now many hospitals are actually in the red and having to borrow money. So I was wondering if you could elaborate on what there is in your mind that hospitals, or where they can find cost savings cuts.
So let's do some comparisons then, if that's the pathway. There was a 3-year period of time under the previous Liberal government where hospitals received zero to their base money. So when I compare what we've been able to do in the last 4 years, $1 billion onto hospital base ensures that we'll absolutely continue to work together. This is work that is happening both with the ministry, with Ontario Health, the regional tables, and of course, every single hospital submitted a plan, what they believed would be the best way to approach protecting frontline patient-facing care and ensuring that we are spending public dollars wisely.
Minister Siobhan Moore, CTV News. Just continuing with Jack's line of questioning, I understand your reference to what the Liberal government did, but under the PC government, there are these questions about, we are, as Jack said, facing an aging population with more complex needs. So is there any room to increase the funding that hospitals are seeing going forward to deal with those more complex situations?
So again, we have seen capital investments already, 3,500 net new beds in the province of Ontario's hospital system since 2020. We are building through many campaigns, expansions, new hospitals, an additional 3,000 net new beds. So we're making the investment on the capital side. We're also making the investment on the health human resources, because you can't open beds if you're not going to have clinicians to serve. And so, I'm very proud of the fact that as a government, we made a commitment to opening medical schools. TMU in the city of Brampton is in their second year of training physicians. We have, of course, right here in Scarborough, another partnership in Vaughan. The last government that actually built medical schools in the province of Ontario was a progressive conservative government when we opened Northern Ontario School of Medicine. So we are absolutely there, planning for the future, planning for those more elderly patients, and of course, more complicated patients. So I think that what you have seen with our government is an absolute commitment to welcome the world to Ontario if you want to practice and you're an internationally trained clinician, but also domestically building our system. And it's both sides, and we're doing both of those things. And again, $1 billion a year for the last 4 years is not an insignificant sum of money for continuing to invest in our healthcare system.
We've seen your colleague, the Minister of Education, consolidate a lot of decision-making around education at Queen's Park, partially, I think, to get a rein-in on spending. Is that something that the Ministry of Health would contemplate?
So our regional tables really are that best practice and that second set of eyes that aren't directly involved in a particular operation. So when we have Scarborough Health Network sitting down with other similar-sized hospitals, the leaders and the individuals, senior management, who are working together saying, how have you done it differently at Scarborough Health Network? How have you made your emergency department more efficient even while you are seeing higher numbers of patients? That's the sharing the best practice that we're doing at the regional tables. We are facilitating it as a province, but honestly, the innovation really comes from the staff and the teams that are doing it across Ontario in hospitals.
Hi, good afternoon. This is a question in your capacity as Deputy Premier. There are a number of MPPs who are charging for hotel expenses despite living, somewhat close to Queen's Park. One of them is here with us today. The Premier has asked all of those MPPs to pay back that money in full. Have those payments been made in full?
I wouldn't be able to speak to the in full part. I know that Premier Ford has been very clear that the expectation is that you will pay back any of those expenses. And anecdotally, I know some of it has happened. I wouldn't be able to speak, Colin, directly to how many.
Okay. Tomorrow, the government should be calling the by-election for Scarborough Southwest. This seat has been vacant since February. I'm curious why it's taken your government so long to call the by-election. Tomorrow, I believe, would be the last day possible on the calendar that the by-election could be called. Why has it taken so long?
So as you know, when individuals vacate their seat, in this case, she chose to leave the NDP party and go run for a seat federally, which was her decision to make. Ultimately, there is a window of how long the government, working with the Lieutenant Governor, can actually call the by-election, and that process is happening now.
Thank you, everyone. That concludes today's press conference.
Thanks, everyone.
Oh, sorry. I think there's a local media outlet. Sorry, Minister, there's a local media outlet.
Good afternoon, Minister and other political leaders here. My name is Logan, and the publisher and editor of a Tamil newspaper, which is 33-year-old. I have one question and I want to get a complimentary message from you as a minister. Because as a government, before that, I would like to mention to you, share with you that me and my family